I actually started out in women's health, first as a labor and delivery nurse, and then I became a women's health nurse practitioner and a midwife. And I love caring for women, but family practice is the best because it lets me treat not only the woman, but also the whole family across a lifetime, and that's something I really enjoy. My approach to patient care is a patient-centered approach. I think that healthcare works best when there's a partnership between the provider and the patient. So this means that there's a lot of listening involved and that I take time to get to know the patient, not only for whatever brought them in today, but a little bit about them and what's going to work best for them. So something that I offer that may be a little different than other family practice providers is that I have a doctorate in nursing practice, but I also have a degree in psychology. And mental health is something I like to focus on. It's interesting to note that the #1 killer of teens in Utah is actually suicide, and that depression and anxiety are medical conditions that affect not only teens, but people across the spectrum of a lifetime. And it's important for people to know that there are effective treatments for depression and anxiety. And something that I like to do is help people find effective treatments, whether it's through medication or through therapy, counseling, mindfulness, or most likely a combination of things, that there is effective treatment, and that is something I like to focus on in my practice. I also offer Suboxone treatment for people suffering from opioid addictions. Opioid addictions are something that often take control of people's lives very quickly, and for months or years, they often suffer from the inability to hold jobs and have relationships, and offering treatment with Suboxone helps people sometimes get their lives back and be able to function as productive members of society and in relationships. Something I also like to focus is on women's health. I have specialty certifications as a women's health nurse practitioner and as a midwife, and although I don't deliver babies anymore, I do enjoy women's health, whether it's from simple things like performing well woman exams and pap smears, to helping people find effective contraception, or guiding people through the menopausal transition is something I love to do. The most rewarding part of my career is probably my patients. I love what I do. I love coming to work every day. But that interaction with patients is what keeps me going, getting to know them, getting to know their families, and then if I can help them in some way, either keep them healthy or help heal and make them well, and optimize their health in any way, then that's just icing on the cake. It's something that I love to do.